everybody. This is Beth from Wellness 360 coming to you from my living room. I think everyone's quarantined right now, so we are going to discuss a little bit about bone health today. So let's start with just some facts. 55% of people over 50 have bone loss. So that is a huge percent rate that really needs to be addressed. Both men and women are affected by bone loss. So yes, there are more women than men that are affected, but both are affected to some degree. 1 in 2 women and 1 in 4 men over the age of 50 will have a diagnosis of osteoporosis. So today we're going to talk about how to keep your bones healthy and different tips that you can do to prevent bone loss and potentially reverse bone loss, which is very possible. So the main concern about bone loss is not necessarily the osteoporosis diagnosis. Osteoporosis is not the dangerous thing. The dangerous thing is hip fracture. So, or just any generalized fracture, but the hip fracture in women is greater. There's a greater risk of having a hip fracture in women than breast, uterine, and ovarian cancer combined. So that's a very scary statistic. So at Wellness 360, we have been really trying hard to teach people and educate people how to keep their bones healthy, how to keep them strong, because we want you to do things naturally. We want to educate and empower you to make better decisions for your own health. So let's talk a little bit about the bones in general. So bones develop when they're in womb. So when you're in womb, your bones are starting to develop. They're really soft and flexible. That's why little ones can roll and bend as much as they can. And as we get older, they do get harder. So, or I should say more dense. At 17 years old, the bones are typically full length, and at age 25 and 30, that is as dense as it's going to get. So it's really important when you're in your younger years to really focus on bone health. The unfortunate thing is at 25 or 30 years old, the last thing we want to think about is bone health. I'm thinking about a lot of other things. I was thinking about raising kids at that time, or going to college or your career, but bone health doesn't get any better after the age of 25 to 30. So bone's job is to protect our organs. They give the muscle something to attach to. So they are really important for the structure of our body. There's 2 types of cells that build bone. So we have our osteoclast and our osteoblast. There's no test after this, so you don't need to know which is which. But the osteoblast is kind of what builds our bones. So it's like cartilage. It fills the bones. Osteoclast destroys the bones. So you kind of have this ebb and flow of bone health. So you have the osteoclasts that kind of come in, they destroy, they eat the bone, they digest it, they release it into the bloodstream. But then you have the osteoblasts that come right in and they build it back up. The problem after a certain age is that the ebb and the flow, they don't work equally. So you're losing more bone than you're gaining. So that is when osteoporosis becomes a real problem. So the one thing about the osteoblasts, though, the building is they're very sensitive to hormonal influences. So progesterone, estrogen, testosterone, growth hormone, thyroid hormones, which I know is really big for a lot of women, being hypothyroid. I know I struggle a little bit with a slow thyroid too. So those kind of things are going to influence the building of the bones. So let's talk a little bit about factors in bone loss. So age, we can't prevent that, right? As much as we try, we can't. So the older that you are, the higher your fracture risk. So after the age of 30, that risk starts developing. So at 30 years old, you're at your peak bone mass density, and then hormones come in and they shift, and after that, your risk increases for fracture. So I'm going to talk just a little bit about hormones. Hormones is really fancy. All I know is they're very, very sensitive to hormonal changes, and testosterone, growth hormones, parathyroid hormones, kind of the things that we just talked about. Hormones can get very, very, very scientific. That's not why I'm here. I'm here to give you how to keep your bones strong. So although genetics is really important part of bone health, genetics is not, it's a very small risk factor. Your environment is more of a risk factor than your genetics. So smoking, alcohol consumption, lack of exercise, lack of nutrition, lack of absorption of your nutrients, those are the kind of things that mean more than your diet, your exercise. The environmental factors mean more than your actual genetic factors when it comes to osteoporosis. So what is osteoporosis? Basically, to make a long story short, osteoporosis is when your bones are breaking down more than they're building. So the osteoclasts are working a lot harder than the osteoblast. So some risk of osteoporosis: one, never having children, having a high history of cortisone therapy, which is big for the work that I'm in physical therapy. We have a lot of people that get a lot of cortisone therapy, and that's a big risk factor. Premature surgery, menopause. So women that have hysterectomies before the age of 40, because that really shifts a lot of your hormones. Like I said, hormones play a big role in osteoporosis. Heavy alcohol consumption, and that is 2 or more drinks a day. So family history, small percent. Smoking, which is something we can all change. No one at this point in time should be smoking because it's really, really harmful for not only your bone loss. Unfortunately, females and fair-skinned and blonde hair have a greater risk of osteoporosis. Hypothyroidism. This is a biggie because I know a lot of people that do have a slower running thyroid. That creates a lot of hormonal imbalances, which can really be a factor involved in bone loss. High fat and protein diet. So all of my keto people out there, no hate mail, but high protein actually steals calcium from your urine. So it's really important to eat your protein, but get it in smaller quantities. We don't need as much protein as generally people think. Let's talk a little bit about the testing. So the testing is typically done standardly through what's called a DEXA scan. A lot of people after 50 their doctors require that. Unfortunately, for the people that don't have a DEXA scan, a lot of times what happens is osteoporosis is kind of a silent disease. You end up fracturing before you find out that you have osteoporosis. So they do DEXA scans. They typically scan your back or your lumbar spine, your hips, and the kind of the neck of your thigh bone, because those are the most commonly fractured areas of the body. I do a lot of strengthening of people's wrist only because when you fall, the first thing that hits is your wrist trying to protect yourself. So I see a lot of wrist fractures associated with osteoporosis. So you have 2 types of scores when you get your DEXA scan. You have your T-score and your Z-score. The T-score, let's talk about that for a minute. So the T-score actually is determined your score compared to people between the ages of 25 and 30 years old. So they take your standard deviations of your bone mineral density and then compare it to one of someone 25 and 30 years old. That's going to give you your T-score. Your Z-score is kind of the exact same thing, except it's comparing your bones to people of your age, height, and weight. So a positive score means that your bones are stronger and healthier than someone that's your age. Or a negative score means that you have less bone mass than someone, an average woman of your size and height. So for T-scores between negative 1.0 and negative 2.5, you're considered osteopenia. So what does osteopenia mean? osteopenia is not a diagnosis. It is an ICD-9 or 10 code, but it is not a diagnosis that it's just like a red alert. It's a, hey, listen, you're starting to lose bone mass. It's time to ante up. It's time to play with your diet. It's time to get exercising. So there's a lot of reversal you can do in the osteopenia stage. I did find out, however, that there is a higher risk in people that have osteopenia than osteoporosis. And I couldn't figure out why until I did some research. It's because most people that have osteopenia are not diagnosed and they're not as careful as people that have osteoporosis. So a score that's less than negative 2.5 indicates you are you do have osteoporosis. Again, we can create more bone. So don't let that be something that's very scary. It should alert you and you should follow your doctor's orders, but there are things that we can do for osteoporosis. There is a slight marginal error when we're dealing with the DEXA scans. Some people have had spinal surgeries, some people have hardware in their system, some people have deformities of their vertebrae, but there's a lot of different ways that they can test for that. There's other ways to diagnose. They have PDEXAs, they have Sextas, they have like small portable devices, ultrasounds, MRI, CAT scans. So CT scans. There are different ways that they can test for osteoporosis. But again, like I said before, it's really important to know that osteoporosis is a real red flag to get your health together, but it is not going to kill you. What is the danger of osteoporosis is the fall and fracture risk. Most wrists, ankles, elbows, shoulders, knees, most of those things are damaged because of break of a fall. So a fall risk is really, really big when it comes to osteoporosis. Then you have vertebral fractures that are caused a lot by falls, but a lot by posture and doing things you're not supposed to be doing. So I deal a lot with this. I deal a lot with people that are at a greater fall risk. I teach correct form and exercise because once you're over 50, I apologize to all of my trainer friends, but no one should be doing a crunch. So when my classes, in my osteoporosis classes, we really focus on the exercises that are going to strengthen your spine functionally, improve your balance, and work on your posture, all things really, really needed for osteoporosis. So those people that have those forward slumped shoulders and that kind of dowager's hump, they really have a lot of pressure on their spine. So all of that weight of their head and shoulders moving forward causes a lot of crushing weight on their spine, and they end up with wedge fractures. There's a lot of people with lordosis, which is low back sway, that it's kind of the opposite way, but it's a lot of extra pressure on your spine, and depending on what you're doing, it can fracture. But the number one risk of a spine fracture, and the best predictor of a spine fracture, is a previous spine fracture. So unfortunately, let's try to avoid fractures altogether, and then we don't have to worry about it. So a hip fracture is actually very dangerous. So a hip fracture is the second most common fracture, and unfortunately, it's the most lethal. It's the most lethal fracture. So the reason for this is the recovery time for hip fractures is a long time, and people are in bed, they're weak, they are deconditioned, they have muscle wearing and tearing, they end up with pneumonia, infections, bed sores, digestive problems from the medications they're on, the pain meds, and not moving, and they're isolated from their friends and family. So there's a lot of depression involved in hip fractures. So it's really important to keep yourself upright. At Wellness 360, we take this very seriously. I know I work at GVPT too. We work a lot with posture, a lot with balance, because balance is really, really important for not just osteoporosis, for any age. We really want to keep you in an upright position as much as possible. I'm going to talk briefly about medications. I am not a doctor, nor do I ever want people to take my advice as going off their medications. So I'm just going to quickly run through a couple of the top medications that I see in the ladies that take my class, and just kind of brush over what they are, maybe a few side effects. But I urge you, before taking medications, please do your own research. It's really, really important that you research and talk to your doctor to find out what's best for you. There's a lot of things that you can do that do not require medication, and we're going to go through those things here very shortly. So we'll start out with Fosamax. Fosamax, basically, remember those two cells, the osteoblast and the clast. So the clasts are the ones that clean out. So Fosamax avoids that clean out process, and it has a lot of side effects though. So a lot of the side effects are gastrointestinal issues, acid reflux, nausea, irregular bowels, bone pain. There is some necrosis of the jaw, a lot of dead bone kind of stuff, auditory canal, and fractures. Actually, if you get a fracture while on Fosamax, there's studies that show there's a slower healing time. So there is also Actinol. It is kind of like Fosamax. The only difference is it comes in a gel cap form, so it's a little easier on your digestive tract. There is a lot of benefits to these medications, but from what I'm reading and what I'm studying, not many people can stay on them long enough to actually get the benefits. And the people that did stay on them, unfortunately, stayed on them for longer than the 5-year period that they were supposed to, and had started having some reverse side effects. So again, I'm not knocking the drugs. I think that this is between you and your doctor. I'm just giving you a couple facts that I've read and I've studied. Then you can do your own research on this. So there's Boniva. It's once a month. It's oral or injectable. It kind of slows down the reabsorption of bone. So again, working on the osteoclast. But it is strongly advisable to take vitamin D and calcium with this medication because it decreases kidney problems. So again, side effects, as all medications are: abdominal pain, hypertension, joint pain. They're all things that, I mean, who are we kidding? Most medications have side effects. So just read your labels, read your the little fine print on your papers you get from the pharmacy. And Reclass, it's annually, it's once a year, and it's really more effective on building bone mass. So I've heard a lot of great things about Reclass. I don't know firsthand. It's I do have a lot of my people that are on Reclass. So again, still wise to take your calcium and vitamin D supplements with that medication. So let's take a little break. Remember, you can ask questions. I can see questions that are being asked if you have any questions. If I don't have an answer, I'd be happy to look it up for you. But we're going to talk a little bit about what are we going to do to combat bone health? What is the reason that we're here today to learn? So there's 3 kind of things we're going to touch on today: mental health, diet, and exercise. So what in the world does mental health have to do with bone loss? So chronic high stress. Who's under that? I mean, come on. No one has stress in their life. So let's talk about stress a minute. Let's talk about emotional stress, job stress, family stress. We are all under financial stress right now. Chronic ill, the physical stressness, insufficient sleep, stress from that, ongoing physical trauma, too much exercise, too little exercise, chronic inflammation. So all of these things are just a lot of things that hinder your bone growth and bone production. So it impairs, so chronic high stress is like a natural low inflammation. So having that natural low lying inflammation impairs new bone growth. It breaks down your bones. So inflammation breaks bones down, and that happens when you're under a lot of stress. So cortisol, everyone knows that wonderful word. That's a stress hormone. When cortisol stress hormone is being released, it is directly associated with like energy spikes, adrenal fatigue, diabetes, metabolism problems, and also impairs new bone growth. So it's really, the more cortisol you have in your system, the more calcium gets lost in your urine, kind of like with protein. So the more protein you have in your system, the more calcium gets lost in your urine. So it's really important to find ways to decrease your stress levels. Wellness 360 has a great mindfulness meditation program that I teach. I also do it online. I'm always in the community talking about stress. Our YouTube channel, Wellness 360, has some guided imagery and meditations that you can do. I do mindful minutes so that we can walk through different scenarios and talk about how to look more at the positive situation and find ways to refocus your perspective. So we're going to talk a little bit about nutrition. Now, I am not a nutritionist. I work in physical therapy, and I also own one of the owners of Wellness 360. So fitness is my thing, but nutrition is super important here. So we partner with a lovely company called Rochester Lifestyle Medicine. They have the most amazing doctors working on lifestyle medicine. I've taken a lot of Dr. Barnett's courses. So I pulled a little bit of things from his courses. I've pulled things from some functional medicine classes that I've taken. So I'm just going to kind of relay the message. Again, I'm not giving you suggestions on how much to take because it's important for you to talk to your doctor. Always talk to your doctor. So I follow a blog called Better Bones Blog. They're out of Syracuse, I believe. They are absolutely wonderful. Dr. Sandra Brown, she has some great posts. She works specifically with osteoporosis. And I also have a great friend from the Messy Kitchen Sisters that does nutritional planning. She's wonderful. She does things online also. These are all great resources for you to learn more about nutrition. But the one thing I do want to take was from Rochester Lifestyle Medicine, and it's so much more important to eat your supplements instead of taking supplements. So eat your vitamins, eat your nutrients in veggie form, not in supplement form. So supplement only when necessary, and we're going to talk why this is super important. The first thing we want to talk about is your absorption. You cannot absorb nutrition if your body is not, or you can't have the benefits of nutrition if your body's not absorbing them. So how do we, what is some signs that we're not absorbing? Frequent antibiotic use, prescription medications, over-the-counter pain medications, chemicals and pesticides in food, general inflammation, food sensitivities. These are all things that some are and some are not in our control, but they're all reasons as to why our bodies might not be absorbing nutrients the way that they should. So you can take all the supplements you want, but your body's not doing anything with it, passing them through. So tips on things that you can do to help your absorption rate of your vitamins. Eat in peace. Be at peace. Sit at your table. It's really hard to eat when you are driving through a drive-through place, which you're probably getting a lot of processed junk anyways, but eat in peace. Eat without the news on. Eat in a quiet place. Eat with your family. Chew your food. Chewing your food is so, so important. A lot of us are eating very quickly, very fast. I'm very guilty of this. I'm a very fast eater because I work and I eat on the run. So I take a bite and I run. So this is something I have to be very conscious and very aware of, but it's really important to eat in peace and chew your food. Eat your veggies. Veggies are easy to digest. Decrease your over-the-counter meds. Think twice before you're taking that Tylenol. Decrease your inflammation. This is actually not as hard as it sounds. Decrease your sugar intake, your red meat intake, gluten, alcohol, your trans fats, your high processed foods, and I'm going to say something that's going to blow your mind. Decrease your dairy. Dairy is an absolute huge thing that causes inflammation in our bodies. Our bodies are not meant to absorb dairy, which goes against all of the marketing of the milk company. But you can drink your milk if you want to. All I'm saying is that there's other ways to get your calcium. I'm not anti-dairy. I do have dairy in my home. My family does eat dairy also. But just look it. Just limit it and try to get more leafy greens in your system. So remember, supplementation is okay when necessary, but if you can eat, the universe did not intend for us to just get calcium. It intended for us to get calcium and magnesium as a group, calcium and zinc as a group, because I'm going to go through these nutrients that are needed for your bones, and you have to have all of these nutrients for your body to absorb the calcium that builds your bones. So if you're just taking a calcium supplement and you're not getting these other nutrients, the calcium's just floating through your system. It's not doing a daggone thing for your bones. If anything, it's landing in your kidneys and causing kidney stones. So we're going to start talking about calcium. You do not have to get your calcium through dairy, although that is a way that you can get your calcium, and that's completely up to you. If you don't have any digestive reactions to it, wonderful. I know that I do, so I have to be very limited with my dairy. And calcium supplementation, if you do decide to take it as a supplement, just be very wary because it can create kidney stones. So work with your doctor on this. It's really important to always be in communication with your doctor. And there's some great nutritionists in the area and holistic medicine doctors that I would highly recommend. So you can get it through sesame seeds, sardines, collard greens, kale, almonds, parsley, leafy greens, mustard greens, salmon, chickpeas, pistachios. These are all wonderful natural ways you can get your calcium. So you can supplement some, but don't supplement a whole lot of calcium. If you're getting a lot of these good leafy greens, tofu, figs, sunflower seeds, these are all things that you can eat to get your daily intake of calcium. So the next, what's called vitamin D, but is actually not a vitamin at all, it's a hormone, is vitamin D. So we get that from the sun. So it's really important that you get outside. Unfortunately, especially in the Rochester area, we get vitamin D very rarely, because even though the sun is out, it's just not at the right angle for the vitamin D. So I supplement with vitamin D. Again, I'm not going to give any recommendations of how much to take, because that's something that's way out of my scope of practice. But vitamin D will increase calcium absorption inside of your intestines. So you need vitamin D for calcium to work properly. So, but you need magnesium for vitamin D to work properly. So do you see where I'm going? We're eating the food where all of these things are available in one food. Makes more sense than taking a handful of supplements. So magnesium is actually needed for vitamin D. So magnesium is needed for D. Vitamin D is needed for calcium. So they all are needed. So magnesium actually pulls calcium out of the blood and drives it to the bone. So you can, if you're drinking alcohol or taking diuretics, you're likely deficient in magnesium. So there's a lot of different kinds of magnesium. Don't go running on the shelves and buying a magnesium. Talk to your doctor first. Find out what's best for you, the medications that you're already on. Maybe cut back on your alcohol intake. And then you can eat nuts and seeds, fish, legumes, dark leafy greens, buckwheat, artichoke, and mussels. So let's go to copper. So copper is needed for calcium absorption also. So zinc, critical for the building of the muscle. So you need zinc for the osteoblast to help build the muscle and the class to break it down. So again, zinc, copper, magnesium, vitamin D, calcium, they're all needed together as a unit, not as individual supplements. Boron, calcium and magnesium retention. So boron, you need boron to keep the calcium and magnesium in the body. Silicon needed for the connective tissue, and that is actually found in the dirt of the veggies. So eat local, eat farm fresh, get your hands in that dirt. And it's also found in, you'll be happy about this, the 4 Bs: beer, beets, bell peppers, and brown leaves, and then leafy green vegetables. So if you want an excuse to drink beer, here it is. You need your silicon. So vitamins, the Bs, B6, B9, your folic acid, your B12, they're really, really important. Now, if you're like me and you eat more veggies, this is something you may need to supplement, because I eat more of a vegan lifestyle. If it's, but you can get it through your foods. And then vitamin K. Vitamin K you want to be really careful about, because vitamin K does not go well with people that are on blood thinners. But you can get them a lot in your leafy green vegetables, fermented foods, but vitamin K needs to happen because that's what holds the calcium in your bone. So we have the one that drives the calcium from your bloodstream to the bone. You have your one that helps the bone absorb it. You have the one that keeps it sealed in there. So they all work together, but the common theme here is leafy green vegetables. The darker the better. Eat from the earth. The more you eat from the earth, the healthier your bones are going to be. So we're going to talk just a little bit about protein. It actually is very important. It makes the collagen framework of the bone, but too much causes acidity in the body. So we want more of an alkaline-based body and less of an acid-based body. So eat enough protein, but not enough that's going to tip the scales. So the too much acid in your body actually pulls calcium from your urine. Okay, so the last thing we're going to talk about, and then we're going to do a quick wrap up, is strength exercises. So the strength exercises are really, really important for bone loss. So how this works is the more force exerted on the bone. So you have your muscles, which turn into tendons, which connect to your bone. So the more force that you have pulling on that bone, the body kind of calls in the troops to build more bone. So that's why exercise is really, really important. So the force of muscles pulling against the bone, the stress that it puts on the bone actually stimulates the osteoblasts to come and build tissue in that area. So we want to build more bone tissue in that area. The more muscle you have, the stronger your bones will be. I can remember going to the doctor complaining that I weighed too much in my 20s and 30s, and the doctor did some kind of diagnostic thing where they checked my muscle mass against my fat percent, and she said that I was so muscular that the more muscle I had at 30 would be good because it was going to keep my bones healthy. So not to be so concerned about what's on the scale, and to be more concerned about your strength, be more concerned about the muscle, be more concerned about building strong muscles to help A, your balance, to help B, help with day-to-day activities and protect your spine, and to build more bone mass. So exercise is good for everything. It lowers your cholesterol, normalizes your blood sugar, it decreases your fall risk, it improves your balance, it helps with weight loss, because the more muscle that you have, the more calories you're burning at rest. So when you're sleeping or taking your nap on the couch, you're burning more calories. It improves your balance, your endurance, your blood and pulmonary function in your body. It strengthens your lungs. I could go on and on for days, but remember, this is my passion. This is what I do for a living. So not all exercise is the same, especially when it comes to osteoporosis. A lot of, when you go to a lot of classes and things like that, you wouldn't know any different. And you're doing these crunches and you're doing all of this forward bending stuff, which actually puts so much stress on your bones. So it really makes your vertebrae more susceptible to injury. So flexion of the spine puts your spine, remember that downward hump? When you build those muscles will really start pulling in the wrong direction, encouraging that forward posture and that forward rolled shoulder dynamic. So you want to really focus a lot on back bends, a lot of back extension. It's much safer for osteoporosis. The only niche there, the only bad part about that, if you have a lot of arthritis in your spine, this could be very uncomfortable. So that's what's really important about working with someone one-on-one that kind of knows what they're doing. because you want to know the right exercises. Physical therapy is really great for that, to get you started. We have a great move program at Genesee Valley Physical Therapy that will get you started. And then we have our classes at Wellness 360, where we work really closely. We have less than 10 people per class, so we can really devise the program and write the program specific to who's in the class, specific to the health history of that person. So the keys to exercising with osteoporosis: walking is wonderful. Hiking is great. You want to be against gravity. The only thing with hiking and walking is you want to make sure you are present. Back to mental health. You want to make sure your mind is not wandering. You're not going in 100 different ways. You're not multitasking, because what happens, you are less aware of where you're walking. People are more apt to fall over rocks and trees and stumps. So it's really important that you are aware and doing a mindful walk when you're walking. When astronauts get launched into space and they're up there for a long time, when they come back, they actually have weaker bones due to not having gravity, that stress against the body. So we use a lot of body weight. So we can do like body weight. Yoga is phenomenal. I'm actually getting ready to post a YouTube video that'll be free for everyone. Wellness 360, I'm going to do a series on yoga for osteoporosis. So if yoga is something you love to do and you don't want to give it up, I'm going to give you tips that you can take with you to your class. Body weight resistance bands are wonderful. We use those all the time in class. Weights, dumbbells, plate weights, anything that is going to add stress on the body. So kettlebells are great. You just want to really watch your technique and your form. Core strength is really, really important for osteoporosis. Core strength is going to help with your balance. Core strength is going to help with your posture. I mean, if I were to go anywhere, core strength is where it's at. But you want to make sure that when you're doing your core strength, you're maintaining a neutral spine. Core strength is not just that six-pack abs, which most of us don't have anyways. We have them, they're just buried with some fluff. But you want to do a lot of things that engage the transverse abdominis, the pelvic floor, the internal and external obliques. There is a lot of the multifidi, little tiny muscles that go up your spine and your vertebrae. Those are the muscles that you want to really strengthen, because those are the ones that are going to protect your spine. Those are the ones that are going to create that space so that your spine doesn't crush down because of disc degeneration. Those are the ones that are going to decrease your back pain. Those are the ones that are really, really important. You're not getting those if you're doing crunches. So number one key to exercising with osteoporosis: stop all of the forward bending, stop all the crunches, working on posture, working on opening up the chest and pulling the shoulders back. I do this in class a lot, where we stand against a wall and we do chin tucks against the wall and we open up our chest, and we're really trying to prevent that Dowager hunch. Remember what I said earlier, the wedge fracture that can be created by that forward bending. So we want to do things that strengthen that spine, all of those extensions, you know, bird dogs, where you're lifting your arm back and really creating strength in the back muscles to hold those shoulders back and open your chest. And last thing, balance. Balance, if anything, is very, very important. Of course, core is number one in balance, but we have a balance and agility class at Wellness 360 that is great for people looking to improve their balance. We have videos that we've made that we have on YouTube. You can email us at info@wellness360fitness.com if you're interested in any of the videos. With everyone being quarantined, we didn't want our patients and our clients and our classes to be lacking, because they've worked so hard to build this muscle, to hold these planks, to improve their posture. We didn't want them to go weeks without having a certain type of exercise. So those are available. Again, our Wellness 360 YouTube page. We're constantly uploading things on Facebook. We have a ton of stuff on modifications and posture and core. You don't have to do core work on the floor. You can do it in a chair. I did a whole series a couple months ago about doing core in a chair, keeping your transverse abdominis tight. These are all things that are really, really important to keep you upright to prevent your fracture risk. So all of these things combine your mental health and being present in the moment, decreasing your stress levels, your nutrition, getting your supplements, supplementing only when necessary, but making sure you're not just taking calcium. Calcium alone is just going to float in your body and be excreted. You have to make sure that you are getting the magnesium, the zinc, the vitamin D, all of those other really important elements to build your bone. And your exercise, you want to make sure you're not only exercising, but you're doing appropriate exercises for bone growth. So remember that wellness is not the absence of disease. Wellness is being exactly who you are in this moment, whatever diagnosis that the doctors have given you, and it's doing everything in your power to make the best steps to keep the healthiest you. That is what true wellness is. So taking a couple of these tips that I've given you tonight will really improve your wellness. What can you do on your own? If you are a smoker, quit smoking. Decrease your alcohol intake. Decrease your sugar, your caffeine, your processed foods. I know it sounds like a terrible life to live, doesn't it? But once you feel healthy and you're eating your veggies and your bones are growing stronger and you get your next DEXA scan and you have reversed your osteoporosis, you will feel so good for your life. Decrease the proteins for every 30 to 40 milligrams of the body loses 30 to 40 milligrams of calcium for every ounce of protein that you digest. Sorry, I kept getting that confused. So really decrease your protein. Still eat protein. Protein is really good for you, just not to the max that people want you to feel like you need to eat. Exercise more. I can't say enough about exercise. Do the correct strengthening things. Wellness 360 has classes. Obviously, we're down now. But when we get back up, we have a balance of balls class. We have a mindful meditation class. We have a class specifically for osteoporosis and taught in 3 locations in the area. We have the videos. We have the YouTube. We have Facebook. Improve your posture. Use general postural exercises of, rows and doing the chin tucks and keeping your back against the wall, pressing your shoulders in. Be aware of your surroundings. Again, be present to your surroundings. Be present to when you're walking, where you're walking. Make sure it's an even surface. If you're hiking, just be aware of roots and stumps. I would never, ever suggest anyone not go outside and hike and walk. I don't know what I would do without the outdoors. I really push outdoors, but just be very cautious. Be mindful. And de-stress. De-stress through meditation, de-stress. A lot of us don't realize how stressed we are until we've sat for 5 or 6 minutes and focused on our breath. So all of these tips today, I hope they're helpful to you. I hope that you can take 1 or 2 or maybe 3 of these tips and create a better and healthier lifestyle for yourself. Thank you so much for joining me today. Again, I will answer any questions that you leave and feedback. If I don't know the answer, I'll do my best to find it for you. And remember, talk to your doctor before making any changes. And I hope that you have an amazing day. Stay safe.